Lipoid pneumonia has been reported in patients with e-cigarette associated respiratory illness and is where there is fat within the alveoli. Symptoms of dyspnea, cough, and acute or subacute hypoxemic respiratory failure are common. Radiographically, lipoid pneumonia usually presents with ground glass opacities and consolidation, affecting the dependent portions of the lung and frequently spares the periphery and subpleural regions. Macroscopic fat attenuation at less than -30 Hounsfield units is virtually diagnostic, but it's often absent on chest CT. Pulmonary and/or critical care consultation should be considered to obtain samples at bronchoscopy for definitive diagnosis. The preferred stain to perform on fresh specimens from the lung, usually obtained at bronchoscopy, is the oil red O stain. It's important to order the stain on fresh specimens from the lung, which means that the sample should not be fixed in formalin or other fixative. When lipoid pneumonia is suspected, this oil red O stain should be ordered and performed on bronchoalveolar lavage or BAL fluid obtained from the most affected areas on chest CT. Again, the fluid must be sent to the pathologist without fixative. If tissue specimens are obtained by transbronchial biopsy or open lung biopsy, at least one fresh tissue specimen should be processed and submitted without any fixative, such as formalin, so that the oil red O stain can be performed.